Hello guys, welcome and welcome back to my YouTube channel. To my returning subscribers, thank you so much for your support and thank you for stopping by here. And for my new subscribers, karibuni sana, this is the place to be. Welcome to Talk to Your Midwife session. This is your very favorite dedicated nurse midwife, Shiro Nurse, and I'm here to welcome you because this is a platform where we get to learn a lot, especially about reproductive health, that is concerning pregnancy, labor, delivery, complications of pregnancy, complications of delivery, the general obstetric emergencies, family planning, conception, and anything including reproductive health. So welcome to this platform. And today we have yet another very wonderful video that we are going to discuss about something that a lot of people have been okay, some have been appreciating, but others have not been appreciating it. And it is just after this video is coming to you after the nurses week, and as a nurse thought that it is good I get to expound on some things, I get to explain on some things concerning the nurses and also the nursing care. So do not just be here, tune in here, and let's learn about the nurses. So nursing in general is the backbone of every hospital. No hospital can survive without the nurses, and no care to a patient can be successful without the nursing care. So for a patient to be treated, to be taken care of successfully and go back discharged, to go back home safely, there must be nurses present. So nursing or nurses are the backbone of any hospital or any healthcare facility that is opened anywhere, whichever level it is. Like in Kenya, we have different levels. We have level 1, level 2, we have dispensaries, health centers, level 3, level 4, level 5, level 6. Whichever level of that hospital is, you must have nurses. For it to be a complete healthcare facility, you must have nurses. The nurses are the backbone. And the nurses are, funny enough, for those who do not know, a nurse is someone who will stay with you for almost 95% when during your care in the hospital. Whether you went to the hospital as an outpatient, that is to be treated and go back home, or whether you are being treated as an inpatient, that is a patient who has been admitted in the ward for some care, whether it is surgery, whether it is medical care, whichever care and whichever type of patient it is, a nurse will stay with you for 95% of your time in the hospital. Okay? So you see, let's talk about now generally the nurses. Who is a nurse, or how my life has been as a nurse. It is so unfortunate to find that the nurses are the backbone of the hospital, but there are people who are dying silently in depression, because anytime there is an unfortunate eventuality, most of the people, most of the clients, most of the patients, most of the relatives will end up blaming the nurse for whatever eventuality it is. And we lack appreciation from our clients or from our patients, and it is so much unfortunate. And I want to clarify this, that there's some things we call job description, and the nurses have their own job description. Rather than the nurses having to work hand in hand with the doctors, there are limits that a nurse cannot go. One thing to specify is a nurse can never is not allowed to perform a surgery. So in case a patient needs a surgery, whether it is an urgent surgery or an emergency surgery or a planned surgery, the work that the nurse does, or the responsibility of the nurse, is basically to prepare the patient for theatre, like giving fluids, making sure the patient is nil per oral, that is not feeding on anything, making sure that the nurse is taking vital signs of that patient to make sure that everything is okay. Maybe take samples, blood samples to the lab, prepare theatre, prepare the instruments that will be used, prepare the gauze packs, prepare the abdominal packs, prepare everything that the surgeon will be using during a surgery. And generally also to help the patient sign an informed consent. And what does that mean? You have to explain to the patient and to the next of kin what the surgery will be about, what is the importance of that surgery, what the surgery will include and everything about the surgery. So you have to make sure that as a nurse, you have to prepare that patient and sign something we call an informed consent before theatre. And also it is your responsibility as a nurse to be able to reach out to the doctor, also to remind them, because they are human beings, they might have forgotten that they have a surgery. So you have to inform them. If it is an emergency, you have to make sure that you're collaborating with the other departments like ultrasound, x-rays, lab, to make sure that everything is prepared for that patient on time. And also reach out to the doctors. In a surgery, we need an assistant surgeon, of which most cases it is the nurse who will be doing that. So you have to prepare yourself psychologically, physically, and all that. Also, you have to call the surgeon, make sure that you know already the nurse knows what specific surgery is to be done, and you know which specific doctor to be done. So it is your responsibility as the nurse to reach out to that surgeon. Also, the anesthetist. Anesthetist is a doctor who gives the anesthesia, or who will make you sleep and not feel anything when we are performing the surgery. So it is also you to reach out to the anesthetist and make sure you inform them on the time and everything. So basically, the nurse will be just there with the patient to prepare and to wait for the doctor to come. And the nurses, we always do our best, because I will be there giving fluids, checking the vital signs until the doctor comes, shaving in case we need shaving, inserting a catheter, urinary catheter. Most of the cases we have to insert a urinary catheter, everything. So I will be with that patient for all that while. Then when the doctor comes, everything is set, everything is ready. I've set everything. So the doctor just comes, get into theater, we just get into the procedure, we are done. The doctor has to write notes after the post-operative notes. This is what we have done, and this is what needs to be done to this patient, and the doctor leaves. So this patient remains in the ward with me as the nurse. So I'll be there to help this patient feed in case it is time to feed, to continue giving fluids, to continue giving psychological support, to continue giving medication to my patient, maybe in case of pain, in case we need antibiotics and all that. In case there were some samples taken to the lab, I will be following up on them and checking the results and informing the doctor that your patient has this and this and this, everything. Remember also, it is my responsibility as a nurse to check other patients that are in the ward, make sure they feed well, they have fed, make sure the medications are given on time, make sure that this patient who was supposed to be taken for ultrasound, x-ray, and any other imagings have been taken to and brought back to the ward safely. Ensure that the patient's discharges are being done on time, because we have processes of discharges. We'll have patients who will be discharged, so you'll have to ensure that the patients are discharged on time. We have admissions. Remember, it is maybe a hospital which has wards, okay? So we have also new admissions coming in. You have to admit patients, welcome them to the ward, orientate them, give their start medications, and plan everything for their plan for that whole shift. Remember, the doctor is not here. If it is the normal wards, the doctor comes in the morning for the ward rounds, okay? Once they are done with the ward rounds, they just leave, and they will just write in the file, I need this to be done, this to be done, plan for this, take this patient to x-ray, take this patient to this, plan for this and this in 3 days. Make sure you're doing, if it is a post-surgical patient who has a wound, maybe uh, do dressing of this wound every 2 times a day, do this and this, check the blood pressure of this patient every 1 hour, and maybe these are like 3 patients. And unfortunately, you find that we have shifts. Every day we have different shifts in the ward. So what happens when you are in a shift? You have to prioritize your patient. So you have to plan your shift in a way that you make sure that you will be able to attend to all your patients on time, and at least so that no patient will end up complaining. Every care will be given, and whatever the doctors want, you have already done them and all that. So every time in the morning, we have to do what we call allocation, because maybe you'll be like 2 or 3 in the shift depending on the ward that you are in. So you have to do an allocation. And these allocations means that at least you are trying to make sure that the patients have someone to be attended to. Now let's talk about the nurse specifically. No one cares on how the nurse is feeling, unfortunately, because you need to attend to the shift. So sometimes we find that most of the times you ask for maybe some sick off, you're not feeling well, you feel like you just maybe need to rest, and you're like you're told like no, you have to come to this hospital, get attended to, let the doctor see you, let the doctor document, and let the doctor like everything should be formal. But you see, sometimes you feel like it is so much stressing, you just need to rest. You'd rather sacrifice the salary of that day just for you to rest. And also, being that maybe you're not feeling well, most of the hospitals will prefer you to go to be treated in that specific hospital. And unfortunately, especially in this country, unfortunately, you find that the hospital that you're working there, that you're working in, most of the times you'll find that even the insurance that maybe you have cannot be able to cater for that. That's something that is so many nurses are facing it. And good thing with the government, those working in the government hospitals, at least those ones can be able to be attended to in those hospitals. But for the private sectors, you find that your own insurance cannot be able to cater for the services that you are offering to your patients in that hospital. Another challenge that we have is about the shifts. Sometimes you'll get to the ward, it's your shift is 7 a.m. Like there was a place. Now I'm giving also from my personal experience. There was a very big hospital in Nairobi I was working in. We used to get to 7 to 7. The day shift is 7 to 7 a.m. But because it was maternity, and there are things that you cannot leave unattended to in maternity, and you have to do a lot of documentation, and it's a very busy hospital with a very busy maternity. So you find that you got into the shift 7 a.m. You're supposed to leave at 7 p.m., but unfortunately, that 7 p.m. is when you're completing your deliveries. Mind you, you have not taken any tea break, you have not taken any lunch break, you didn't take anything, you didn't eat anything, you didn't drink anything, maybe some water as you pass by, as you rush from one room to the other, conducting deliveries, conducting CSAs. You have to go to theater and scrub and all that. So it's 7 p.m. You haven't completed you haven't done any documentation. Not completed. You haven't even started any. What you know, I know you have seen nurses having their hands written on all over. You write on your hands, maybe this delivery, or most of the times you'll have some small piece of paper full in your pocket, or even you write on gloves and put it in your pocket, so that when you're done with all the deliveries, you'll sit down and now start documenting in the patient's file everything that you had done. So at that 7 p.m., that is when you're sitting down. Already the night staffs are here to come and take their report. So you have to give out report. This is what we did. This is what we did. But they cannot receive those files before they are completed, because either way it makes sense. No one will know what happened. So at least you have all the clue in your mind. You have to make sure you document it yourself, and then they get into their shift, their duties. Now you sit down. You'll do documentation. You have to watch the instruments that you used during the delivery. By the time you're done, it's around 9:30 p.m. By the time we are getting from the hospital to the bus station, where we'll board a matatu to town, then from town to wherever someone stays, by the time we are getting a matatu, it is already around 10. By the time I'm getting to where I live, it's around 10:30 p.m. or 11 p.m. Good thing I had a supportive husband who will take the kid from the daycare, take care of the kid, feed the kid, and sometimes I find even the child sleeping. So you can imagine, you as a mom, you haven't spent a whole day with this child. You're coming in the evening, the child is already asleep. So even when there's some maybe delayed milestones or some issues with that child, you might not be able to find that. And also you find that the attachment, the bonding between you and your child, or you and your children, is so much affected. Also remember, you have been so busy. Even when you come to the house and the child is not yet slept, you're so tired, extremely tired, that you cannot even be able to play about with your children. So you find that you have a very big gap between you and your children. And you have to work. You have maybe to take care of them because of the economic crisis. You have to at least to bring in something small. Your husband brings it something small, or your spouse brings something small. You then you can use that to raise your kids successfully and happily. So that is another challenge. Then another challenge is issues with the management. No doctor cares how busy you have been as a nurse in that shift. What the doctor wants when he comes is everything that he has ordered, he wants it done. Okay, so no one will care. Even the management of that hospital don't care how you're going to manage a shift which has 20 patients and you're only two nurses or three nurses. No one cares, especially with the private facilities, because after all they are there to make profit. Also, even the government hospitals, we have a lot of shortage in the government facilities. Okay, I don't know why. I don't know, but no one cares. The management doesn't care how you're going to manage all those patients by yourself, by two of you or three of you. No one cares how busy that is. Sometimes you get to ask for help, maybe from the matron, then they go and source nurses. So it is in maternity, but they're going to source a nurse from the medical ward or a nurse from the surgical ward. This is a nurse who has maybe worked all his lifetime in the surgical ward. He can't remember what was being done in maternity, because in maternity you really need a lot of experience. Okay, so sometimes you can imagine someone who has been working in the medical ward, surgical ward, or in ICU for like 5 years, then you expect him or her to come to maternity and assist you in a delivery. Okay, so some of these things you find that maybe the nurse is there, yes, he or she is willing to help, but because she's not sure of what to do, there are maybe some delays in care. And what happens in case we have an unfortunate eventuality? The relatives are there, they are seeing whatever you're doing as a nurse. The family members maybe are around. The patient himself or herself is seeing whatever is being done and is noticing that we have some delays. Then at the end of the day, what happens? Me, Esther, because I'm the nurse there in maternity, I end up being framed a very negligent nurse. Remember, even this one, where the nurse who had come to help was not neglecting the patient, only that she wasn't sure. She's waiting for me so that she can ask me what to do next. Okay, so you see, I as the nurse, we as the nurses will not, we will be blamed for whatever eventuality it will be, for the delay of care. But the problem really was on the hospital, because if the hospital had employed enough nurses, there would be no delay of care. So you see, we get to be blamed of so many things that happen, even if they are not within our reach or they are not within our job description. Let's talk about the doctors. The doctor will just come. I mentioned before, the doctor will just come, perform his surgery, write in the file that this is what I need to be done. In the morning, if it is the medical cases, no surgery, medical cases, the doctor comes in the morning for just like less than an hour. He's just coming very fast, reviewing the patients very fast. Very fast. In fact, he doesn't want to waste any minute, because maybe he's being waited somewhere for a locum, okay, or for an extra shilling somewhere in another hospital, maybe to go and see two or three patients. So he comes, he just reviews the patient, sees this is how the progress is, adds this medication, give this medication, I have changed this to this, I have changed the dressing of this wound, it should be dressed after every 2 weeks, okay, or whatever it is. He comes, reviews with the patient, and goes away. So what is the work of the nurse? Is to remain back with the patient for the rest of the shift, or for the rest of the time this patient will be in the ward. So the nurse remains with this patient for the rest of the time that he or she will be in this ward. So anytime the patients want to turn in the bed, the nurse. Anytime the patients need some food or some fruits, the nurse. Anytime the patient is coughing too much, the nurse. Anytime the patient has some pain, the nurse. Anytime they feel that the surgery was not done well, the nurse. Anytime the laundry person has delayed to bring new bed sheets, the nurse. Anytime the patient has soiled, the nurse. Anytime the patient needs some basins or somewhere to urinate or to excrete on, the nurse. Anytime the patient feels like the TV is not working, the network is not okay, the Wi-Fi is not strong, the nurse. Anytime the patient feels that the bill is too much for them, the nurse. Anytime the patient feels anytime the patient feels anything, anytime the patients want anything, anytime the relatives feel like they want to just express their anger concerning that hospital, the nurse. Anytime the relatives feel that this bill is too much, the doctor is not doing enough, the nurse. Anytime the relatives feel like their patient is not being taken care of, the nurse. All the blame goes to us, the nurse. What happens to you as the nurse? You have done your best. Sometimes you are there in the shift and you're very sick. No one gave you a sick off. You are not able to maybe pay for your own, maybe because the salary has not yet been paid, you're not able to pay for your maybe a hospital, what do you say? You say a hospital bill you cannot be taken care of because you still don't have money, you're waiting for end month probably. You have kids at home, you haven't seen them because every time you get from shift they're asleep, or sometimes when they are not asleep, you are on night shift, they are going to school, so you have not met them. You feel drained, you're so tired physically, you've been turning patient, you're just 50 kgs. The patient, you have patients in the ward who are weighing 100 kgs, 120 kgs. You're the one who will be bathing them, turning them around. So you're exhausted, you're tired, you're drained, you have a lot of backache. Psychologically or mentally, you feel depressed, you have no one to talk to. Okay, maybe you have a spouse who you want to express yourself to, but sometimes they might not understand because they are not in that field. In the hospital, the management is just they're just staring at you, and they're just like this, like a roaring lion. When you go to talk to them, they're telling you, we have a lot of people who still need this job, so if you feel like you cannot do the work here, if you feel like this work is too much, you can as well leave, then we employ other people. So you have no one to talk to, you have no one to run to. So what happens? You have to come to shift. Sometimes we even leave our kids sick at home. Sick at home, you're not even allowed to go and even take your own child to the hospital. Sometimes you have to give maybe your house help your child to take them to the hospital. I can remember in that specific hospital that I'm talking about, our in charge some time back had a very sick son for almost a whole week, and she had to come to shift, and she was told when she went and to complain, not even to complain, she was called by a neighbor that you know what, your son is worse, your house help has just come to call me to check on your son because he's convulsing, the fevers are too high. So the husband had to come faster to the house, take the child and take the child to that hospital that you are working in, where now the wife is working in. And so she was there crying to the matron, like, please, give me like an off for some hours. I go to the casualty, to the emergency department. I assist my husband because my husband is panicked because our son is convulsing. I go and assist in managing that child until the child is stable. Then I can continue with my shift and the child will go home. And do you know what the matron told her? Here in hospital, we have not employed your son, we have employed you. So you don't have to come here and complain about your son. Can you imagine? It was so traumatizing. We really cried because how now, what on earth is this? And remember, you have to come to the ward, assume everything is okay, smile to your patients, feel strong. There is a patient who has been diagnosed with a chronic illness. Assume that you're strong and offer you a shoulder for this patient to lean on your shoulder, a shoulder that is so weak, a shoulder that is so broken. You have to make sure that you encourage patients. You have to smile to the patient. There is a woman there who is crying because her child is so sick. A couple is so depressed. Their child is so sick. Remember, your child is convulsing in casualty. You cannot be able or allowed to go and attend to him. But but this hospital expects you to manage this couple, encourage them, smile to them, offer them your best so that their son will be well, encourage that their son is going on well. You know, so unfortunate, so unfortunate. No one is offering a shoulder for the nurses to lean on. The relatives of the patients nowadays, everyone has a phone, everyone has a smartphone, so they are waiting for you to make a slight mistake and they are recording you. And after 2 minutes, everything is on social media. That this son was coughing in front of our patient. This nurse was doing this in front of our patient. We asked this nurse this, and she told us she's not the one to perform the surgery. This is negligent. This is so rude of this nurse. You are all over social media. So the nurses are dying in depression. And because you don't have anyone to go and talk to, you're depressed. You are just locked up in a very different kind of life. Unfortunately, what is happening to a lot of nurses, they end up abusing drugs because we have a lot of drugs in the hospitals. In theater, we have the anesthesia drugs, which you can abuse. We have the strong painkillers that the cancer patients use and can be used as can be abused also. You just want to take something so that you feel good. So if this nurse is not somewhere taking alcohol so that they just feel like they want to forget everything, this person is somewhere abusing drugs, because you have to work hard for your family. Remember, you have siblings, you have family. They still need you to support them. You have a spouse, you have children. You have to make sure you have this economy which is messed up. You have to offer your best. So what happens? These nurses ends up abusing drugs. At the end of it all, this nurse will end up maybe committing suicide because there is no shoulder to lean on. The doctor is there, then management is here. The matron who is supposed to maybe advocate for the best of you as a nurse, he or she is there. She's just against you. Everyone is against you. You have no one. You can't even, if you even go to the hospital, to the churches, you can't even kneel down and pray. You just feel like crying. You ask God, why did you even call me to be a nurse? You see. So the nurses have been so stressed, and we are not even appreciated. This is for everyone. Now that you know, remember, these nurses will be your savior. When something is happening and we need to resuscitate you, the nurse, will start the resuscitation before the doctor comes from wherever God knows he is in. Remember, I am the one who will rush to save your life even before this doctor gets here. So kindly, kindly, it is a plea. Now that it is just immediately after Nurses Week, I want to cry out to everyone, not only Kenyans, but also everyone, wherever you are, whichever country or state you are in. Please let us learn to appreciate our nurses. A nurse can be your own mom, a nurse can be your blood sister, or your brother, or your dad, or your sibling, or your brother or sister, or your own son or daughter, or whoever who is the closest person. A nurse can be your spouse. I have a spouse, and I can't imagine him being somewhere blaming the nurses of something that maybe has happened to his or her relatives. When he remembers whatever I am passing through, he can never do that because he has seen how much we have worked. So this is a cry out to everyone, wherever you are. Take this as your responsibility. Respect the nurses. Remember that this nurse might be so broken and so weak and in tears. There is a lot of times we lock ourselves, especially when you have lost a patient or something has gone the way you had not planned. You lock yourself, you cry out yourself, you just cry because you can't cry in front of the patient. So sometimes we are so broken, we are so depressed, we are so weak. So please, wherever you are in, anytime you visit a hospital, you see a nurse, just say hi to me, just a hi. Hi, you're doing a good job. Congrats. Hi, you're so smart. You see, these small comments are the ones which are keeping us going and going and going. Please, please. Thank you so much for watching.